we have nurse practitioner Kari Endres. Good morning, Kari.
Good morning.
How are you?
I'm doing well, thank you.
Good. And joining you is Robin Henry. She's been a guest before, Chief Population Health Officer with Solvera. Hi.
Hi, good morning.
How are you?
I'm good, thank you. How are you?
Good. Did you enjoy the health forum?
I did, actually, and I've received some positive feedback just from our internal Solvera Health community, but as well as those that have listened to the podcast, because we did share it on social, and it was very engaging.
Good. It was fantastic to have everybody in the same room. Brilliant people being able to talk about our community healthcare, our wellness, and the future of healthcare. So that was good.
Absolutely.
Okay, Kari, tell us about yourself. We've got listeners in the Fulton County area.
Well, I was born and raised in Fairview, Illinois, so close by, farming community, and I've always lived in the area. Currently, I live closer to Brimfield, but it's kind of where I'm from. I've been in healthcare for over 20 years now. Most of my time was spent as a registered nurse, but after attaining a couple of master's degrees, I taught at a couple of the colleges in the area, and then I attained my ultimate goal as a family nurse practitioner and practicing with Solvera Health in Galesburg.
Wonderful. So, family nurse practitioner, you've been doing this over 20 years. What are some of the changes you've seen in nursing, in healthcare in general?
Oh, many changes. I think one of the more exciting positive things is just really the focus on health and wellness and kind of bringing mental health issues to the forefront, talking about things like this more and people feeling more open to take care of themselves.
Okay, good. And you've got the healthcare background, like you said. What drew you to healthcare?
Yeah, I really like helping people. Taking care of people is my passion, and in family care, it's really exciting because it doesn't limit you to just a certain demographic or a certain type of illness or something like that. You get to see everybody from newborns to people celebrating their 95th birthday, in the same afternoon. So it's really, really fun, and women, children, just kind of the gamut of everyone.
Sure. And what are people coming in with these days?
Well, right now we're kind of really been focusing on doing some wellness things, back to school. People are kind of getting their Medicare annual wellness visits out of the way before the end of the year. We haven't really started seeing a ton of, the cold and flu type stuff yet, but it's definitely starting slowly.
It's allergy season again.
Yes.
I mean, it's so wonderful to have this cool air, but you sleep with those windows open, you kind of get a little bit of the allergies in the morning.
Yeah, seeing a lot of that, and with the really hot weather, just kind of keeping everybody safe and hydrated and being mindful of that.
Okay. And Robin, you've been there since the beginning with Solvera. Remind folks about Solvera Health.
What makes Solvera Health special is we are comprehensive. We like to consider the care we give impactful and meaningful and all under one roof. It's that convenience. We want to help our patients and our guests navigate the healthcare continuum because it can be kind of tricky. So we do have our Medicare specialists also that are always available, free consultation, never an obligation. They're there to help, with being present in Galesburg as well as on our Peoria space. But it's just, continuing to find our way to yes and helping our patients find what they need.
Okay. Carol McCreary was just in from the Strom Center getting ready for Medicare Part D enrollment. So glad you brought that up, Medicare consultation. What's that about? That's very interesting.
We do. So Solvera Health, we do have our own consultants with WLM group. So Colin Cusack, he's very involved with that as well. Comes into the Galesburg space anytime. Everybody has a cell phone. It's on our website. He's always more than happy to take these calls. But it's finding during that open enrollment, but finding if it's that Medicare D package, but what works with their medication formulary. We don't want medications that are needed for life-sustaining and maintenance and, for the overall wellness to cost so much. Right. So we want to work with them in finding that plan that is conducive and will help them in the long run.
Okay. And right here in Galesburg, 256 South Swangataha Road, I do believe. And that's where Dr. Julio Santiago is as well, right?
He sure is, right with Kari.
Yes. And with Kari, of course. Who else is on the support staff and the team there in Galesburg?
It's been our same team there since inception as well. So Dawn Tatro is our practice manager. She's still with us. And we have an amazing team.
Okay, fantastic. And what's on the horizon for Solvera as we head into the end of the year?
We're doing a lot of focus on our Medicare beneficiaries, really maintaining what their picture of health looks like, and through that lens, continuing to focus on our chronic care management, as well as just closing their buttons and keeping the population safe within Solvera. We have also expanded into visiting provider service lines, so we are into the assisted living communities and memory care and senior care living.
Okay, that's a big expansion for you guys.
That's great.
And wellness, we definitely got to be thinking about the coming up. We've got Breast Cancer Awareness Month, Diabetes Awareness Month. What kind of wellness opportunities can we call you about, Kari?
Well, the comprehensive piece of it is really kind of what we focus on. When somebody comes in for wellness, it doesn't really matter the age. We just kind of really narrow in on what's pertinent for that person. So whether it's, recommending screenings through mammogram or colonoscopy, getting vaccines up to date, there's always something for everyone. So no matter who we see, we just kind of look at that person as a whole and figure out where they're at in their healthcare needs and try to recommend what's current.
Okay. And you guys also are working on other providers you're able to work with for the labs, being able to go to specialty locations. What are some examples of how that has been successful for you guys, Robin?
Well, if you look at one of our specialties in Peoria with Dr. Sorrow, focusing on Lyme disease and treatment, he's also kind of expanded that to mold exposure. And so, it does take certain specialty labs to find these results, and we want to do it, being fiscally responsible for the person as well, because it could incur a lot of out-of-pocket costs. So we are working with our lab companies like LabCorp, for example, or Ingenix Labs, and just seeing what kind of package we can do to best support the patient.
Okay, yeah, we had a chance to talk to Dr. Sorrow. Yeah, he was interesting. And Lyme disease, that is a crooked disease, meaning it takes a minute to figure it out.
Right, yeah.
Very, very different. And do you go to Peoria at all, or just in Galesburg?
I'm in Galesburg 5 days a week.
Okay.
Yeah. Mm-hmm.
And how do people get a hold of you? Because you are accepting new patients.
Yes, yeah. Dr. Santiago and I are both accepting new patients. Just call the office and we'll get you set up.
And what do people typically call about? Is it a broken bone? Is it just, what are the types of services?
We kind of do everything from we covered wellness visits, acute visits, like as in you just aren't feeling well, wake up with a sore throat, whatever, something like that. We also offer women's health. So if you needed, any kind of screenings for women's health, we take care of children and to our seniors too. So really basically any need that a family practice doctor would take care of, we are there. And then when you need a referral to a specialist, we can identify that and refer you to the right place. So yeah.
Okay, that's good to know. Robin, anything else you want people to know about Solvera Health?
Essentially with me, it's just how proud we are of where we've come. We're coming into 2 years in August of this year from our startup in Peoria, and then we've just celebrated our year here in Galesburg, and we do have our space in Carbondale. And so just seeing how this is encompassed and the growth and the interactions with these patients that we have, because we are an independent healthcare entity. But again, to Kari's point, we partner very well with our community leaders and healthcare as well as our hospital partners. And I think we're going to continue to do that, and we're just again, going to be there with our patients and find that way to yes and help them through this journey.
Okay. Well, thank you for coming in.
Thank you so much.
I appreciate it, and I'm going to see you again next month with Dr. Julio Santiago.
Yes, you are.
And Kari, welcome to the team. Good to have you back in the area.
Yeah, thank you.
That is family nurse practitioner Kari Endres, also Robin Henry with us from Solvera Health.